Next, we'll be meeting with Dr. Dr.sheef. He is a consultant in internal medicine and blood clotting and blood vessels, Department of Medicine, King Fahd Medical City in Riyadh. But we'll go first for this report.
Irritable bowel syndrome, or IBS, is a chronic condition affecting your large intestine. Your large intestine, also known as your colon, includes the cecum, ascending colon, transverse colon, descending colon, sigmoid colon, rectum, and anal canal. The muscular wall of your colon contracts in a rhythmic fashion called peristalsis to move the intestinal contents toward your rectum. As it contracts, your colon absorbs water and nutrients from partially digested food moving through it. Waste material, called stool, is stored in the rectum until it is expelled through the anus as a bowel movement. With IBS, the muscular contractions of your colon are abnormal. In some cases, the contractions may cause food to move too quickly through your colon. As a result, your colon does not have enough time to absorb most of the water from your food. This condition leads to a watery stool and diarrhea. In other cases, the contractions may cause food to move too slowly. As a result, your colon absorbs too much water from your food. This condition leads to a hardened stool and constipation. It is unclear why your colon contracts abnormally. However, if you have IBS, your colon may be more sensitive to certain factors such as stress that seem not to affect most people. Other symptoms of IBS include abdominal pain and discomfort, bloating, gas, and cramping. You can manage your IBS symptoms through a combination of dietary habit changes, stress management, and medications. Eating food high in fiber creates softer, bulkier stools, which may prevent spastic colon contractions. Fiber also helps relieve constipation. Stress management therapies, such as hypnotherapy and yoga, may help relieve your symptoms.
Hello again, everyone. Thank you for staying with us. Now we'll be talking with Dr. Dr.sheef. He's an internal medicine consultant, also blood clotting and blood vessels specialist at Department of Medicine, King Fahd Medical City in Riyadh, Saudi Arabia. Dr. Muhammad, welcome.
Welcome. Okay, it's a great pleasure being with you on your wonderful program.
Dr. Muhammad, thank you for being with us today. Let's talk about irritable bowel syndrome. What is it and how common is it?
So, irritable bowel syndrome is a chronic condition of the digestive system. It is one of the most commonly diagnosed gastrointestinal disorders, or is the most common actually. And it is the second most common cause of absence from work after common cold. It is a functional disorder. What does it mean, functional? It is disturbance in the functionality or function of the intestine and colon. It is not organic. It's not cancer.
It's not a disease.
It's not a cancer. It's not inflammation. It's not. It is just a functional disorder that chronic, and the most predominant symptom is abdominal pain.
So it doesn't kill anybody.
That is not serious disease.
It's not a serious disease. It's nothing to be afraid of.
Sure.
No. So it's a functional disorder. How common is it in general, either in our society or in any other society, like in Europe, United States?
Sure. As I mentioned, it's the most common gastrointestinal condition. Its prevalence, it's about 10 to 20% in the general population. We have local studies in Saudi Arabia, it's 10%. i.e. 1 out of 10 is affected. However, this is underestimated prevalence, because there are some studies indicated that only 15% who are affected by the disease, they seek medical attention or seek medical help. Most of people, they might manage themselves, okay, or they don't seek medical attention. So it is very common disease.
Probably they use folk
syndrome.
medication or some fiber or whatever they could get their hands on. Now, how is it diagnosed? How do we know this person has IBS, irritable bowel syndrome, or have something else? I mean, what do we do to get to that point?
Excellent. So we need to know the symptoms of the disease, what are the it can be confused with many other gastrointestinal diseases, like inflammatory bowel disease, like ulcerative colitis, Crohn's disease, or malabsorption, celiac disease. It can be diagnosed, confused with many. How we diagnose it? So we have to first take history, proper history examination, and proper blood test, and sometimes we need radiological investigation. So the predominant symptoms, the most common symptom is abdominal pain, and usually the abdominal pain is crampy abdominal pain due to contraction of
gas formation maybe, or constipation.
Sure. So abdominal pain is the most common, and the pain is crampy, and it's relieved by bowel movement. That's very important. So the pain triggered by eating some kind of food or by stress. That's why the name, we say irritable bowel syndrome. So there is overactive bowel, okay, to certain foods or to stress or anxiety. So that's important. Abdominal pain, crampy, relieved by bowel movement or defecation, and associated with altered bowel movement. That's very important. So they might have constipation or diarrhea, all alternating diarrhea with constipation. And that what characteristic for this altered bowel movement, they have the diarrhea, there is extreme urgency, i.e. that once they have the urge for bowel movement, so they have to rush.
They can't wait, they have to go now.
They can't wait, definitely. And as I mentioned, to relieve the abdominal pain, and at the end, they might experience what we call a sense of incomplete emptying of the rectum or the bowel. So that's why they will stay longer period in the toilet, straining. In fact, already the bowel is evacuated. And sometimes we have a mucus with the stool. That's what characterizes. They might have other symptoms like gas, bloating, and other symptoms, nausea and vomiting. So this is the characteristic symptoms. So the symptoms is very important. History, age is important. So this is a disease of young age or young adulthood. If it is in elderly, always you should have red flag. We don't think about irritable bowel syndrome. We think about serious diseases like colon cancer. So important, we have to find the right clinical setting. In addition, physical examination, usually unremarkable, normal physical examination, and normal investigations. So usually investigations, we do investigations to rule out other diseases. It is a diagnosis, we call it of exclusion. We exclude other serious disorders, and sometimes this is what we need, just basic, simple investigation. We don't need to go for ultrasound, for example, or colonoscopy or sigmoidoscopy in the most case scenarios, but some settings we can go for advanced investigations. There is what we call formal set of diagnostic criteria. We call it ROM criteria. ROM criteria, so they have to have symptoms 3 times per week, lasting for more than 3 months, and you have to have abdominal pain, crampy abdominal pain, and associated with 2 of the 3, relief with bowel movement and altered bowel habit, or the change in the frequency or in the form of the stool becoming looser in this setting. If you have 2, in addition to abdominal pain and more than 3 months, we call it irritable bowel syndrome. These criteria usually does not replace clinical judgment as a physician. We have to, sometimes we deviate from that criteria. But it's a good tool to help us to make diagnosis.
Kind of help, kind of guide you through sometimes. Now, how do you, differentiate it from? I mean, do you have to do other things to differentiate it from other problems? Like some people with depression will have some GI complaints. Similarly, some people with depression will have headaches or low back pain. Is it the same, kind of in the same setting? It's caused maybe by some neuromuscular type effect?
That's a very important question. There is association between depression or anxiety with functional disorders. We found depressed people, they have more irritable bowel syndrome. They have more migraine. Headache. So there is a strong association. That's why stress and anxiety are not direct cause of the disease. They are triggering factor. They associated, they worsen the disease, but it's not a direct cause. Sometimes that's why we treat irritable bowel syndrome with antidepressant medication or anti-anxiety medication. That's why, because they share the same underlying pathology. And it's interesting about this disease, about stress and anxiety. Usually it is, as I mentioned, a functional disorders. A benign is not serious disease. But these patients, because of the anxiety or depression, once they have the abdominal pain, always they think about serious disease. They think about
something serious.
Cancer. This exactly triggering. It is like vicious cycle. It will worsen the abdominal pain. So they have functional disorder. It's a benign.
Do you have a placebo effect there, maybe because of what they believe in or what they think?
Sure. That's why psychotherapy is very important. Reassurance. Reassure the patient. It will break the cycle. These patients, once we reassure them that this is not a serious disease, I usually ask the patient. I don't wait them to volunteer this information. Are you afraid or concerned about cancer? Or you say, yes, this is what making the pain, adding fuel to the fire. That's why we have to sometimes, treat 3 aspects of the disease or patient, comprehensive, what we call, approach. Psycho, bio, psychosocial. Bio is the biological factor, psychological and social. All they integrated and play an important role in the pathogenesis.
There is a big movement all over the world now, especially in Japan and South Korea, Europe, United States, Canada, and many countries, including we started one here in Saudi Arabia. We just started, which is using food and behavioral training and a lifestyle training to improve or to be an added value, if you will, treatment to help with many conditions, which will not replace the original treatment, but would help with the treatment. Do you think that would help with these people?
Yes, definitely. It's the mainstay of treatment is dietary changes and psychotherapy. Dietary changes because, as I mentioned, most of the time the pain triggered or worsened by stress, anxiety and food. So what we call elimination diet. So you eliminate the foods that trigger the abdominal pain. And usually there are lists of food. But however, a patient is the best physician of himself, we say. He knows what kind of food that trigger. So the list, the long list, not necessarily the patient that might have all these. Some, for example, common food like dairy products contain lactose. It is different than lactose intolerance. So dairy products that contain lactose like milk, cheese, yogurt. In some patients with irritable bowel syndrome, it does worsen the abdominal pain. So we usually, elimination diet, we ask the patient to abstain or avoid this food for 2 weeks. If the pain improved, so we ask the patient to continue, avoiding this. If not, we ask the patient just use it back again. There are classical list of food apart from the dairy product, the fava beans, the beans. So the beans, it is one of the important triggering factor for irritable bowel syndrome. I know the disease is a complex. That's why we call it
Now,
syndrome.
Is it the beans or the bread with the beans?
It's the beans. You know, that's why the fiber is one of the important treatment strategies for it. But sometimes fiber, because of the beans, it has beans have the highest quantity of fiber among other foods. So what happens usually, the
Too much fiber? Maybe?
too much fiber. Most of the food digested in the small intestine and absorb the nutrient, the small intestine, and water absorb the colon. And colon is the function is elimination of the waste product. So the beans is not easy digested, usually partially digested in the small intestine, and the other half or 50% will be digested in the colon. Digestion in the colon, that will by the bacteria, we call it fermentation process, it will secrete or generate gas. The gas, this is that will cause abdominal pain, crampy abdominal pain, and the contraction, spastic colon we call it, or contraction of the colon. That's why they will experience the crampy abdominal pain. That's why we need to use the antispasmodic medication to relieve the contraction. I think important food, always most of the, just reassure the dear viewers that most of the time the disease is controlled by avoidance of food, that trigger the abdominal pain and psychotherapy. And sometimes we need to use medications.
You know, now these days in Ramadan, a lot of families, they use full and falafel, with breakfast and suhoor.
Sure.
So if you have irritable bowel syndrome, maybe you have to look at that again.
Sure.
But I always ask a question: is it the bread, tamis, like we call it here, or is it the full? So what gives you heaviness and you feel tired and your stomach, cramps? Is it the full or the bread? I don't know any studies looking at that. Maybe a study should be done. They'll be happy doing it. They're eating food and full and tamis. What about males and females? How common is it? I mean, who gets it the most? Is it the males or the females?
So females are affected as twice as more likely than
males.
So this is the international prevalence. I think this is like as anxiety, depression. It's more.
It
common.
goes along with the same numbers.
And interesting, some female patients who have irritable bowel syndrome, they have the abdominal pain worst with menstrual cycle.
Because it's also the depression is worse.
Sure. Yes.
So it's a PMS.
Yes.
Premenstrual syndrome.
Yes.
It's very common. So if your wife is having trouble during that time, it's not you. It's just PMS.
Sure. Yes.
So be nice. Any complications? Anything you want to warn patients about with IBS?
It's a benign disease. It's not serious disease. It will not lead to colon cancer or inflammatory bowel disease in the future. So many studies done, and they followed up patient for many years, and sometimes they have complete resolution of the disease, or they will be under control with dietary changes.
Does
very
exercise
important. Oh, very important. I think exercise. This is area of research that exercise does help irritable bowel syndrome. One of the treatment modalities. Once you, especially in patients who have constipation predominant irritable bowel syndrome. So if you exercise like by jogging or running or walking, it will help you to move your intestine, small and large. So it will help to regulate your bowel contraction.
So if something stuck, you wiggle it and it moves down.
Sure, it is one. It has been studied, and it has led to improvement in irritable bowel syndrome.
Dr. Muhammad, let's go for this report, and then we'll be back talking about irritable bowel syndrome with Dr. Muhammad Sheef. Stay with us.
Individuals with irritable bowel syndrome, or IBS, can have difficulty controlling embarrassing symptoms like abdominal pain, constipation, diarrhea, and bloating. If you suffer from these symptoms, consider changing your intake level on some of these foods. Remember, each person's body responds differently to what they eat, and it is important to find a diet that works for you. Broccoli is high in fiber, but it can cause painful gas and bloating. If you don't want to give it up completely, try lightly steaming broccoli instead of eating it raw. Like broccoli, cauliflower can be an IBS trigger food as well. If you're using it to replace white starch like rice and potatoes, try switching to brown rice or quinoa for a less starchy, bloat-free option. Green peppers are tough to digest, so they can cause uncomfortable bloating and stomach pain. Instead, try red peppers or ripened green peppers for easier digestion. Full of protein and fiber, beans can cause bloating for those with IBS, which is a good reason to limit them in your diet despite their nutritional benefits. Fatty foods can also cause unpleasant IBS symptoms. That's why cooking with butter and loading it onto vegetables can spell trouble for those prone to gassiness. Lentils are another legume that can be difficult to digest, and unfortunately, they are a hidden ingredient in many soups and meat alternative products. The worst cheese offenders are the creamy cheeses, such as brie and mascarpone. If you suffer from IBS, try hard cheeses like Parmesan and Swiss instead. Steer clear of milk and cream products that cause unpleasant IBS symptoms. Both can spell double trouble if you also suffer from lactose intolerance.
Hello again, everyone. Thank you for staying with us. We're talking with Dr. Muhammad Sheef, internal medicine consultant, and also blood clotting and blood vessel disorders consultant at Department of Medicine, King Fahd Medical City in Riyadh, Saudi Arabia. Dr. Muhammad, continuing talking about irritable bowel syndrome. What about fasting and irritable bowel syndrome? Does it make it better? Does it help? And how should they fast?
Sure, they can fast without any problem. Fasting is not a contraindication, okay, for irritable bowel, or irritable bowel syndrome is not contraindication for fasting. So, you know, nowadays fasting is prolonged hours, reaching up to 16 hours.
Yes, about 16 hours a day because we're in the summer now.
Sure, and it is there is relief of the symptoms during the fasting time. So the problem, it comes not only the change of the food habit, the change of the sleep pattern, reversal of sleep pattern. So there will be a complete change in the lifestyle during Ramadan. So sleep pattern is we sleep the day and wake up in the night, and the food which have changed, complete change of the food. So once we have the breakfast, I think that what trigger or worsen the abdominal pain, that after, you know, empty stomach for 16 hours, we attack the food.
Yeah, a lot of people do that.
We attack the food, or we, I will say, feast. Feasting. So patient with irritable bowel syndrome, they should have a gradual introduction, okay, of food. They start by dates, water, then they pray, then they start, you know, gradual, okay, intensification.
And small amounts. They should
Small
not.
amount.
I mean, eating or feasting, like you said, it shouldn't happen, because you are overwhelming your systems,
Sure.
your stomach, your heart, your kidneys. Everything is overwhelmed once. You know, that's not a good way to do it.
Yeah, stomach is inactive or sluggish for 16 hours, and all of a sudden you
It needs a warm-up
challenge.
first.
You know, yes, you need warming, okay, preparation. So you're challenging the stomach with, let's say, attacking the food or feasting. Not only the rapidity or how fast you eat, the other thing, the kind of food. You know, in Ramadan, our, you know, diet contains a lot of fried food. You know, fried food.
And sugar.
Again, one of the trigger is fried food. Has a lot of sugar, and spicy food. Again, spicy food can trigger the irritable bowel syndrome. Onion, soft drinks, all these, you know, can lead to worsening of the abdominal pain during Ramadan. That's why people who have irritable bowel syndrome during Ramadan, it's one of the terrible, you know, period for them. because they
Especially at night.
yes, often experience abdominal pain. It is easy, it is under control if you just start, slowly, and you eliminate certain foods that cause abdominal pain. One of the important manifestation of irritable bowel syndrome after abdominal pain is altered bowel habit, constipation. So second most common symptom during Ramadan, constipation.
Is it because they're not drinking enough water, or what is it?
Definitely, because due to fasting, prolonged fasting, they will have dehydration, inadequate ingestion of fluid or drinks. Remember, this is irritable bowel syndrome patient. They usually have regular bowel habit, usually postprandial. Once they wake up in the morning after breakfast, they will have their bowel habit. We call it gastro-colic reflex. This is involuntary act. But during Ramadan, because loss of this reflex, so they will have disturbance of the bowel habit, and in addition to dehydration. So that's why important, they need to consume larger quantities of water to avoid and fiber diet. In addition, they might require use medication as laxative.
Dr. Muhammad, let's go over some of the foods that people should avoid, and maybe some of the foods that they should eat on a regular basis, not just Ramadan, in about maybe 30 seconds or 40 seconds. That's a lot of time. Sure.
So this is the list. As I mentioned, every patient knows the food that trigger. Okay, but this is a list. It's good that we know that we said to avoid the lactose dairy product that contain lactose, like milk, cheese, yogurt, butter, and cream. And there are foods and beverages that are better tolerated by irritable bowel syndrome. We say friendly to the colon. These important, like water, rice, milk. Rice is fine, especially rice if you have white rice. And potatoes, breads, as you mentioned, bread like French, Italian, whole white is fine. Fish is okay.
It's good.
Eggs, soft and boiled. Cereals, this is important. Cereals are really friendly to the colon and stomach. And cook peas and salad. The salad, like lettuce, is fine, but the other category of food that contains high fiber, certain vegetables like green beans and cabbage, sprout, broccoli, generate large quantity of gas that cause the abdominal pain and sometimes bloating. I think this is the list, but as I mentioned, a general guide.
Excellent. Dr. Mohammed Al-Sheef, internal medicine consultant and also blood clotting, blood vessels consultant, Department of Medicine, King Fahd Medical City in Riyadh, Saudi Arabia. Thank you very much for being with us today. Thank you very much, everybody. We'll see you again next week. Have a happy Ramadan and happy Eid, and take care of yourself, and don't eat too much. Avoid fried foods and sugary foods, and you'll be fine. Take care. Bye-bye.